Hi, my name is Isabel Ordonez, and I am going to talk about how to floss your teeth properly. Johnson & Johnson research shows that 87% of people either floss infrequently or don't floss at all. Now, some of you might ask, what's the importance of flossing? And three big reasons for flossing are: number one, the most practical, is flossing gets in between the areas that toothbrushes don't. Uh, Reason number two is people who have both gum disease and are overweight are more likely to have heart disease, according to the Archives of Internal Medicine. And then three, flossing along with brushing promotes healthy gum tissues, which also helps us protect our teeth and bone. So some of y'all might ask, well, how often should I floss? The American Dental Association recommends that people floss at least once a day. Some doctors like for you to do it maybe twice a day, so I guess the best rule of thumb is to floss the top arch in the morning, and then you can floss the bottom arch in the evening. What are steps for proper flossing? I guess a good rule of thumb would be to take about 18 inches of dental floss, and it could be a floss of your choice. Some people like wax, some people like mint flavored. It's based on preference. And you take your two index fingers and wind it up in your index fingers, and you'll wind up the majority of it on one side, and then you'll take your thumbs and actually use it to make it taut, and this will help you guide it in between the teeth. When you take your floss, a lot of people are discouraged to floss because they say that it hurts, so it's very important to be very careful when you're going to floss, because a lot of people actually injure the gum tissues, which are very sensitive and can get cut very easily. So what you do is you take your floss and you slide it between your teeth, just like so, and you take it up towards the gum. You press gently against each side of the tooth, making sure that you loosen any plaque or debris from food or things that you may put in your mouth, and you've cleaned that general area. Once you've done one tooth, you can spool that thread on the finger that has less floss, and then you've got a nice clean area of floss to floss the next tooth. And again, you'll slide that up between your teeth and press it gently against both sides of the tooth. And you'll repeat this throughout all your teeth and so on. Now, there are alternatives for flossing. People with fixed bridges, people who have braces can't use traditional floss. For people with braces, we like to use dental flossers, which are basically kind of like a needle and thread. And what you'll do is you'll take your floss and thread it through a flosser, and it's got a pointed tip, and it's easier to guide in between the brackets and so on and so forth. Interproximal brushes are these little tiny Christmas tree brushes that are good for getting in between teeth, and they have little bristles, soft bristles, and they do get in between those tight spaces, especially for people who have trouble getting in the back areas. Interproximal brushes are excellent. There's also an array of floss picks, and you can find these at your local drugstore, and it's kind of a cross between a toothpick and dental floss. And these are really good because this larger side can actually take out larger chunks of food out of from in between the teeth, and then the floss is more of a refined clean. Again, these are just other options. And there's also a water pick, and you can find that at your local drugstore. And basically what it is it's kind of a toothbrush without a brush end, and water flows through the bottom, and you just aim it in between the teeth, and the pressure of the water actually pushes the debris out. Now, these are all alternatives even for people with less dexterity in their hands, like elderly people who can't really get their hands to work the back part of their teeth. So these are great alternatives for flossing your teeth. Now, you don't have to brush and floss all your teeth, just the ones you want to keep.